How does PTSD affect chronic fatigue syndrome? How does post-traumatic stress disorder influence chronic fatigue syndrome? This is a crucial question for many individuals navigating these complex conditions. Research indicates a strong connection between PTSD and chronic fatigue syndrome, also known as myalgic encephalomyelitis. Studies show that people with PTSD are at a higher risk of developing chronic fatigue syndrome. In fact, trauma exposure and the severity of PTSD symptoms often correlate with a diagnosis of chronic fatigue syndrome. For instance, individuals who have experienced childhood trauma, including sexual abuse, may see their risk of chronic fatigue syndrome increase by 3 to 8 times. Additionally, the prevalence of PTSD among those with chronic fatigue syndrome is significantly higher than in the general population, with rates ranging from 18 to 29% compared to just 1 to 5% in the community. From a physiological standpoint, PTSD may play a role in chronic fatigue syndrome through the dysregulation of the hypothalamic pituitary adrenal axis. This dysregulation can lead to hypocortisolism, which means lower cortisol levels. Cortisol is essential for managing stress responses, energy metabolism, and immune regulation. When cortisol levels are reduced, it can disrupt energy supply and lead to the profound fatigue characteristic of chronic fatigue syndrome. Moreover, low cortisol levels may not adequately suppress pro-inflammatory cytokines, which are substances in the body that can promote pain and cognitive dysfunction. This ongoing immune activation can exacerbate fatigue and other symptoms of chronic fatigue syndrome. Given the overlap between PTSD and chronic fatigue syndrome, trauma-informed care becomes vital in treating individuals with chronic fatigue syndrome. Addressing PTSD symptoms through appropriate psychological therapies can help manage some aspects of chronic fatigue syndrome. However, it is important to note that chronic fatigue syndrome involves complex neurological and immunological dysfunctions that go beyond psychological factors alone. It is not a psychosomatic illness. Brain studies have shown altered electrical activity and cognitive impairments that are distinct from psychological conditions. Therefore, treatment approaches for patients with chronic fatigue syndrome who also have PTSD should integrate trauma-informed interventions alongside standard medical management of chronic fatigue syndrome symptoms. This comprehensive approach acknowledges both the physical and psychological aspects of the condition. In summary, PTSD can significantly affect chronic fatigue syndrome by increasing the risk of developing it and contributing to fatigue, pain, and cognitive difficulties through stress hormone dysregulation and immune system activation. Understanding this relationship highlights the importance of trauma-informed care in therapeutic interventions for patients with chronic fatigue syndrome who have experienced trauma or have PTSD. However, it is crucial to ensure that treatment remains comprehensive, addressing both the physical and psychological dimensions of chronic fatigue syndrome in line with current medical guidelines. Always consult healthcare professionals for personalized medical advice.